Good morning, everybody. In the last week, we had 750,000 people who came forward to get vaccinated in New South Wales, and we're inching ever so much closer to that 70% double dose figure, which is so encouraging. Can I please encourage everybody to come forward and vaccinated? And those of you who haven't, please make sure you book so that we can get to that 70% double dose as quickly as possible. To 8 p.m. last night, there were 1,281 cases of community transmission in New South Wales, and regrettably 5 people lost their lives, and we extend our deepest condolences to their loved ones. Late last week, I received modelling on when our health experts think the peak will hit in terms of the number of cases, what the ICU requirements might be, and what the number of people in hospital might be. And I'm pleased to say that today we'll be making all of that public, but I do want to qualify all of that to say that modelling depends on a number of things, a number of variables. And if too many of us do the wrong thing and there are too many super spreading events, we could see those numbers not be what they are. But I do want to stress the following, that today Dr. Chant will outline that we have 177 patients in our intensive care units with COVID. At any given time in our hospital system, there'd be around 400 people with non-COVID related issues in ICU. And so our surge capacity, including staff, in our intensive care units is 1,550. So just to give people that reassurance, we certainly don't want to have to use all those beds and that staff, because we know what a pressure it will put on the system. But I want everybody to be reassured that the capacity is there. And today I'm pleased to say that we have Susan Pearce, who's Deputy Director General of the Department of Health, to talk about those operational issues, and Dr. Nguyen, who is one of our specialists who actually put together the plan. To talk about the 18 months worth of planning that's gone on to ensure that we have a surge capacity of 1,550 beds in intensive care. All those figures are now publicly available, so all of our citizens can look at what we have today, what we look like, what we think we'll have. And according to the modelling that I've received, we're likely to reach a peak in cases in the next week or so. That's what the modelling tells us, and therefore a likely peak in intensive care beds required around early to mid-October. So that's what the best modelling tells us at this stage, but I do want to qualify that by saying that a number of variables are associated with that modelling. And I'm really pleased and grateful that Dr. Nguyen has made herself available today again to explain to us all the planning that's been involved, all the staff retraining, all the allocation of resources, and also a status report. Whilst things are stretched now, we appreciate they're going to have additional pressure put on the system in the next few weeks. And I just want to again thank all of our hospital staff, every single staff member, whether they're medically trained or otherwise, who keep our hospitals going in advance, as well as our ambulance and paramedic staff, who will be required to work together, as they do every day in our health system, to support the community at that time. But as Dr. Chant and the Minister and myself say almost every day, the best way we can keep people out of hospital, out of our intensive care units, is by getting vaccinated. And we've already seen what a difference vaccination makes. The higher the vaccination rate, the lower number of proportion of people who end up in hospital, and that's certainly what we'd like to see emerge in the next few weeks. So I'll ask Dr. Chant now to give the health update. Then Deputy Premier will talk about the regions. Susan Pearce from Health will talk about the operational changes or the operational imperatives that we've put in place to cope with the additional cases in hospital. And then Dr. Nguyen, as a clinician, as an expert, will talk about the plan and all that's gone into it to make sure that we have that surge capacity available. Thank you.
There were 1,281 locally acquired cases of COVID reported to New South Wales in the 24 hours to 8 p.m. last night, and 1 overseas acquired case. 136,455 tests, so pleasing to see the community continues to respond to our request to get tested and get tested early. There are about 11,000 people with COVID who are currently being cared for by New South Wales Health, and we have about 1,071 COVID cases admitted to hospital, 177 people in intensive care, 67 of whom require ventilation. They span all age groups, and it is critical that we understand that COVID presents a risk across all age groups, so please get vaccinated. In terms of the deaths, sadly, we have been notified of 5 people who have passed away. A man in his 90s from southeastern Sydney died at St George Hospital, and he was a resident of the St George Aged Care Facility in Bexley and acquired his infection there. He was fully vaccinated, but he had significant underlying conditions. There was a woman in her 80s from northern Sydney who died at Ryde Hospital. She had received one dose of a COVID vaccine but also had significant underlying conditions. A woman in her 50s from Western Sydney died at Westmead Hospital. She was not vaccinated. And a woman in her 80s from Western Sydney died at Westmead Hospital, and again she was not vaccinated. And there was a gentleman in his 60s who died. The case has been referred to the coroner. He did test positive on after his death through the coronial process, and we're still getting details about that case. So my key message is please get vaccinated, please get tested early, and seek help when you need it. Even if you've done something that you think is a breach of the public health orders, even if you're concerned about anything, please do not know that we will not care about what you have done. Health is caring about you, and our priority will be providing you with care. So please get tested early, and seek care early. There is a sewerage detection in Byron Bay, and again call forward the community for testing. And in terms of suburbs of concern, Greenacre, Georges Hall, Auburn, Bankstown, Dubbo, Bass Hill, Guildford, Marylands, Punchbowl, Blacktown and Yagoona. I'm also calling out Central Coast, and some areas in Wollongong we're also seeing cases. So it is important that no one in the community is complacent. Case numbers outside the local government areas of concern are also increasing, so everyone needs to get tested if they have the most minimal of symptoms.
Good morning, and I start by offering my condolences to those families that lost loved ones overnight, and you remain in our thoughts and prayers. In Western New South Wales, up to 8 p.m. last night, there were 44 cases. 35 cases were in the Dubbo local government area, 6 cases in Burke, 2 in Orange and 1 in Narromine. In the far west, 7 cases overnight, 6 in Broken Hill and 1 in Wilcannia. Southern New South Wales has seen an increase in cases as well. 3 cases in the Queanbeyan Googong area, 2 cases in Goulburn, and since 8 p.m. Last night we've been already notified of an additional 2 cases in southern New South Wales, 1 in Batemans Bay and 1 in Cooma. In the Hunter New England area, 5 new cases, 1 in Port Stephens, 1 in Maitland, and 3 cases are from the Lake Macquarie local government area. The Illawarra Shoalhaven area is starting to be an area of concern. 21 cases all up, 9 cases in the Wollongong local government area, 8 cases in the Shoalhaven local government area, and 4 cases in the Shell Harbour local government area, and again 8 new cases on the Central Coast. Can I put a call out to the people and the community of Wee Waa and Narrabri? The Narrabri vaccination numbers were one of the lowest in the state. Over the weekend, the New South Wales Government, in partnership with our local GPs, our pharmacists, set up walk-in clinics over 2 days. Almost 1,000 people were vaccinated, and that is an unbelievable result for the communities of Wee Waa and Narrabri. We're still there today, and again, a call out to everybody to get vaccinated. Vaccination is the key to protect regional rural communities from these outbreaks, more importantly, about our pathway for the future. Thank you.
Thank you. I'd like to make a couple of comments with respect to the hospital system before I hand to Dr. Nguyen. The health system throughout this pandemic has demonstrated time and time again that it can respond to the challenges that COVID has presented to us. We've been planning and preparing for this increase in cases since the start of the pandemic last year. And this will be an incredibly difficult and challenging time for our health system as we work through this. The plans that have been put in place, however, are only as good as the people who deliver them. And my message at the moment to the public is we have amazing health staff who are out there each and every day working really hard to deliver the best possible care to our patients, and we will continue to do that through this period. What we're experiencing now is not normal for our community, it's not normal for our hospital system, but we will get through this as the wonderful health system that we are and that we have always demonstrated we are for our community. My message is to reassure the community that anyone who requires ICU care during this period will get it. and it will be continued to be delivered by our exceptional staff who are out there working every day, as I said, to care for the many patients that we're looking after in hospital, but also those who are in the community. At least 90% of people with COVID are cared for in the community, and that's also a very important reminder. The Premier touched on the vaccination numbers for last week, so 750,000 across the state between New South Wales health clinics and our primary care partners, an amazing result. Over the last 3 weeks alone, New South Wales Health has given almost 1 million vaccines. We were given the challenge with that Pfizer that came from Poland to deliver all of that. We've done that, plus what was already booked in. I said at the time it would be challenging, but we got there, and I am so incredibly proud of everybody in the New South Wales health system who has contributed to that vaccination effort. If we want to see things change in our hospitals and the pressure on our hospitals and our ICUs, the best and most significant thing we can do now as a community is get vaccinated. Thank you.
Good morning, everybody. So although the Premier sort of said that I was coming up to talk about my plan, needless to say, this has really been an effort of the whole team. And I want to sort of take you through, I guess, the journey of that team from March of last year. And if you remember sitting in your lounge rooms and seeing those images come through from Italy and New York of patients on ventilators in corridors, and our ICU and ED specialists overseas really sort of starting to highlight to us what the impact of COVID was on their health systems. It was about this time that myself and other advisors that were brought in to support the health response. And we knew that it was a call to arms, and we started off getting the equipment because we knew that a lot of our equipment required sort of shipping from overseas. You would have heard it well reported that we were aiming for the 2,000 ICU beds. And through March, we planned and we rallied. And through a strong public health response led by Dr. Chant and the whole of system sort of response, we breathed a sigh of relief in April, where we reached a maximum number of 50 patients in the intensive care and only 20 of them were ventilated. And then we spent all of 2020 continuing to build on our plans. And these plans systematically worked through all the things that we would need. We asked our colleagues at each of the hospitals to identify areas where they could set up an intensive care if needed. We asked them to identify staff who they could train and who they could bring in. And then when we had this little blip, actually probably more likely that we had the timelines, if you remember, we then had the surge in Victoria, and we watched our Victorian colleagues deal with it. And I think importantly, what we did was we remained connected. And we were connected as clinicians at a state level and nationally and internationally. And that has really put us in good stead. So we asked all the hospitals to identify key areas where they might be able to set up intensive cares. And you've heard of projects that have been done at Royal Prince Alfred Hospital and North Shore as examples of the system and the hospitals and our staff getting ready. We know that at times the health system and our clinicians might feel a bit disconnected. But what became very clear was this connection and collaboration became crucial. And I can honestly say that our clinicians on the front line are the most connected they've ever been. So this connection is amongst, there's a lot of emphasis and a lot of attention to intensive care. But in fact, it's about the whole journey. We know that our ED clinicians and our respiratory clinicians on the wards and all those nurses and doctors who are looking after patients who aren't affected by COVID depend on us to collaborate and coordinate in order to respond. So what are some of the practical things we've been doing? As I've already talked about, we've gone and sort of identified areas, and each hospital has identified what their surge. So when we talk about surge capacity, it's an indication of which areas they could expand into. These are places like recovery or coronary care. We know, and you've heard this many times, and many clinicians will say to you, you can have as many ventilators as you like, but it's our highly skilled critical care nurses who operate the ventilators that we need. And I would echo Susan Pearce's advice to say it's all about our staff. Okay? And you would appreciate that ICU is a very critical care requires a very significant, a different skill set. But what we do know is our colleagues in operating theatres, our colleagues in ED, our colleagues in coronary care share some of those skills. There have been registers that have been set up to call for those who may no longer be working in intensive care but could come and join the health response if they were needed. Our teams have continued to train and do simulations and other things at the hospital level. And so the training has continued, and like I said, workforce will continue to be our biggest challenge. Earlier this year, we heard about the pandemic coming through the Delta wave, through India. And although there was this lull over Christmas, and maybe, to say there was all this work being done in the background, since about sort of March, April, we've started to ramp that up again. And we've been fortunate. None of those plans that we spent working on in 2020 had time to gather dust. We've been working on, we have a very good idea about where every ventilator is. We have these registers about our staffing. We're sharing resources in regards to education that through our communities of practice, which are in intensive care and many others throughout the whole health system. I think really importantly, we have really amazing visibility of where all our patients are across the health system. And when you hear stories of patients needing to be diverted elsewhere from either an ED, that's actually a sign that the system's working. Okay, the system's working because it's recognition that to provide the best and timely care for those patients is actually not at an ambulance, in the driveway of an ED. It may be that it's to divert across the city. When we hear about reports that hospitals are going into crisis mode, it's actually that they said the system's working. We're continuing to learn when the right time is to divert, and we divert patients, and we won't always get that right. We've watched our colleagues in Western Sydney become under a lot of significant stress because of where the COVID patients have been. You hear about patients being transferred, or intensive care patients being transferred across the city, down to Wollongong or across to North Shore. These are all signs that the system is working, and we're all here to help each other, because the intensive care community recognises that patient care, the best patient care, occurs at the right place at the right time, considering all other factors from staffing to other sort of factors across the hospital. Our fundamental principle is that we should approach the intensive care as one whole unit. So you can imagine, we talk about hospitals having big and small, but in fact, we're really an intensive care of over 500 beds, and the state's approaching it in that way. We will try and continue to share to move patients around and to bring staffing to those areas under strain. So we've been signalled over the last week that the numbers are going to rise. Does it worry us as a critical care community? Of course it does. Is this the biggest challenge that we're going to have as a health system? And will we be in crisis? I'm really confident that we have plans in place. Our critical care staff remain committed to providing the best and compassionate care that they can. Over the coming weeks, they may very well need to move to provide care in unfamiliar surroundings. We're going to be drawing on our specialists on the wards, particularly the respiratory disease, like the lung doctors, and you saw Dr. Morgan here last week describing the patients she was looking after in the wards. We know that there are nursing staff and medical staff who will feel a little bit uncomfortable with what they're being asked. But I'm really confident that we've got such a well-connected and supportive environment that patients will continue to get care when they need it. We've planned an intensive care advisory service. So this is a sort of a phone line that you can call to get expert advice if you have both clinical issues or equipment issues. That's been established to determine if it's required. And we know, my phone's almost always on, very rarely off. And as a testament to the connections we have, we get texts, and I get texts, and we have mechanisms in order to feed that into the system. We're really fortunate to have an almost completely vaccinated workforce. And we have PPE available, which is important to make our staff feel safe. So they turn up every day doing the jobs that they've been trained to do to care and serve the community. So over the coming weeks, we're going to continue to work on the plans we've made and refine them and really evaluate what's worked and what hasn't. And I think that what's really demonstrated, particularly over the last few months, how responsive the health system can be and how resilient our staff are and how committed they are to providing compassionate care. I can't emphasise enough, though, how difficult and exhausting this is going to be for our staff. So, with an eye on providing best patient care, we're also looking out for each other. We're making sure that staff have adequate breaks, and we make sure that they have time off. You'll hear stories and reflections from staff about having to work double shifts. Everyone is tired, we recognise that. But we check in and make sure everyone's okay. We're used to looking after critically ill patients, but our staff, the majority of them, will not be used to seeing the number of patients they're seeing at the moment and the number that are going to come through the doors. Many units across the city have really benefited from generous donations of food. It's mostly chocolates. You'll know that all intensive care staff love chocolates. And these have been things that seem small, but they've been important for the morale of our staff. Importantly, we've been really thankful for the community and their support for getting vaccinated. So although the projected numbers look challenging and frightening enough, we know that without vaccinations and without the public health orders, the numbers would be much worse. So every member of the broader health team are working hard to serve the community at the moment. There are many stories, like I said, of staff feeling tired. They're working long hours and extra shifts. And everything is taking longer because of the PPE they have to wear and the disconnection that they feel with their patients. But we're supporting each other in many ways, and together we'll get through this. Please help us by following public health orders and getting vaccinated as soon as you can. Thank you.
What is going to be the peak of ICU demand for the modelling you were given at the end of last week? Because this modelling here was released on the 25th of August.
Look, the best modelling I received last Friday is an indication of what the numbers, the projections are likely to be. So what you have in front of you is the best and most recent advice I received on Thursday and Friday last week. Well, I'm just telling you that I asked for the up-to-date modelling last Thursday and Friday so I could release it to the public. And what is there now is best advice I have. It's in black and white, and can I please extend my deepest gratitude to Dr. Nguyen and her team, and it is a team, because what we've put in place reflects at least 18 months of hard work. And what it also reflects is the best estimate of our health experts. As we've seen in this pandemic, it's difficult to pinpoint every day what the numbers are going to be. But as I've also said, especially in the last few weeks, the most important numbers for us to look at are keeping a keen eye on that ICU capacity, because we know that surge capacity with staff, we have 2,000 ventilators, but when you're talking about beds themselves with staff and experts, we have 1,550 surge capacity, which we hope we won't use. In fact, there's a gap in our figures as to what we're likely to need and what we have available. We hope we won't get to that. But I hope it gives all of our citizens confidence that anybody who needs care in hospital will receive it from our outstanding staff, who will be doing it tough, but that's what they've been trained to do and prepared to do. But also, please know that the figures we've provided have a lot of variables. It depends on all of us doing the right thing. It depends on not having super spreading events. Any super spreading event can skew the figures. But I ask to have the best available. What you have in front of you is the best available advice that I have as the Premier, is the best available advice the New South Wales Government has. That's what we base our decisions on, and that's why we've made it public.
Premier, this estimates that the peak COVID ICU demand would get to 560 people in ICU right on November pretty much. Is this modelling based on reopening, as we're planning to, all the venues and different things that we are still intending to open?
This modelling is based on the number of people who remain unvaccinated and the number of cases we're likely to get through the peak period. And that is why we've made it public today. So the public has confidence that our system has been preparing, the system is ready, and we hope so much that people will continue to get vaccinated, continue to stay at home unless they have to leave home, because that reduces the likelihood of them acquiring the disease and certainly reduces the likelihood of anybody ending up in hospital or in intensive care. And whilst the focus today is very much on our clinical staff, our hospital staff, who have just been amazing and will continue to need to front up every day and take care of patients at their sickest, we also want to acknowledge all those health professionals that are supporting around 11,000 people with COVID in the community, people who aren't unwell enough to be in hospital but who are being monitored to make sure that if their situation deteriorates, they do end up in hospital. So it's a very complex system. We're meeting the challenge. We've made all the preparations. You have what the public has is the best information I have. And if there's any updates or changes, of course, we'll also make that clear.
In October and November, the patient to staff ratio will change. What advice have you received of how that will impact on patient care?
Well, obviously, as Dr. Nguyen said, patients will receive all the care they need, especially intensive care patients who are the most vulnerable. So the reason why we asked Dr. Nguyen and Susan Pearce from Health to be here today is to explain to you directly that the work we've been doing in preparation, the resources we've made sure that we have, is to secure that level of care for everybody who walks or who comes through those doors. And will the healthcare be dealt with differently or be administered differently? Yes. As Dr. Nguyen said, you may be moved to a different hospital than the one that's closest to your home. You might have slightly different surroundings as what you would normally, but the bottom line is that anybody who needs that care will receive it. Our surge capacity, we estimate, is in excess of what we'll need. But as you know, all good planning means you prepare for more than what you think you need to make sure that if things go a different way than what you anticipate, that everybody is covered. And again, just a thank you to everybody in our health system, both front-facing, but also those behind the scenes who are monitoring our patients.
I just wanted to one thing. Sorry, I just didn't quite get an answer on that one, which was, is this based on New South Wales still being closed, so pubs and clubs and restaurants and things being closed, or does it take into account the fact that we are going to open up so that on the 1st of November we are going to have some things open?
Yeah, but obviously when we do open up at 70% double dose, anyone who interacts with each other will be completely vaccinated. So that massively reduces the chance of anybody requiring hospitalisation. So what you have in front of you is what we best anticipate will occur, but that is why the Doherty modelling, the plan that the national plan is based on, the modelling, the research that the national plan is based on, assumes, which is the case, that high rates of vaccination prevent people from coming into hospital. And as every day we give the health updates, you'll note that it's very rare for somebody with no underlying conditions, with double dose vaccination, to end up in ICU. It does happen occasionally, but it's extremely rare. And this is what living with COVID is about. We know that every day when our vaccination numbers tick over, that's an extra layer of protection for our community, and as Dr. Nguyen said, an extra level of reassurance for those staff who have to deal with patients every day. The more people we have vaccinated, the less chance you'll have to meet Dr. Nguyen and any of her team. And that's what we want to see. We know that the double dose vaccination is an enormous protection against hospitalisation. I'm incredibly proud of the way in which our citizens have responded and come forward to get vaccinated. It's just been outstanding. To think that we're at 73.5% first dose already, over 40% second dose already, we are really, really doing well. And the best thing we can do for our wonderful staff and for our loved ones is to get vaccinated, to follow the health orders, and that's why we've been very strict. This is why it's 70% double dose. Only those who are vaccinated will be able to enjoy the freedom that brings, because there is still a risk of not overwhelming the hospital system, and that is what living with Delta means. You always have to keep a keen eye on two things. What is the vaccination rate, and what is your ICU capacity and how many people you have in ICU. I'm sorry?
What about paramedics? We're already seeing very long wait times at hospitals over the weekend. What's being done to surge the
Well, there'll be further information provided, but the ambulance and paramedics are key to this strategy, because ambulance and paramedics might pick up somebody from a particular suburb in a hotspot, and rather than taking the patient to the closest hospital, they may be required to take the patient elsewhere. So the plan that's being presented to you today, which there's more detailed information for those of you who want that, the detailed plan talks about how ambulance and paramedics are very much integral to this strategy. This is a whole of health system strategy. It's a whole of system strategy where everybody acts as, well, we are one team, but it's making sure the health system is connected as one team, one network. And the most critical question to ask is this person going to get a good quality of hospital care? And the answer is yes.
A couple of weeks after that we reach these peaks to when we reach 70%, can you guarantee those changes for freedoms are still going to occur at 70% even though we won't have peaked?
Yeah, absolutely. And the reason why it's really important for us to get this information available to all of our citizens is that the biggest determinant of whether someone ends up in hospital or not, the greatest determinant, is whether they've been fully vaccinated. Of course, we know some people have very serious underlying conditions or age issues or other issues which make them particularly vulnerable. But the health experts will tell you, and I'm sure they'll jump in if I'm making any mistakes, is that the biggest determinant of whether, scientifically or on the statistics, the biggest determinant of whether someone ends up in ICU is whether or not they're fully vaccinated. And that is why every day that goes past, every week that goes past and our rates of vaccination increase, that puts less pressure on our hospital system. It puts less pressure on our world-class clinicians. And that is why we've been in a race to get vaccinated. That's why in New South Wales we've been keen to step up. And I'm so proud of our health system, who, in addition to the GPs, who've been amazing, and the pharmacists who've been amazing in providing vaccine, New South Wales Health has done over 1 million jabs in the last couple of weeks, and that's an amazing result.
What's the hospitalisation rate?
This modelling is based on, do you know that? And also on that, when was the hospitalisation rate 5.5% and who gave you that information?
Yeah, well, that was based on a national figure that was used nationally at that time. Yeah, that was a national figure used in modelling. But please note that in addition to this modelling we've made public today, every week our experts put out a weekly update which talks about the hospitalisation rate, the number of people in hospital, the number in ICU. That is weekly information provided. But what this model does is give people a medium and long-term look at what the next few months will be like. It's not just a week-by-week look, but it's what the next few months are likely to look like. But all modelling, I mean, very few models are perfect. So I just want to make that point. It's always striking the right balance in providing the public with as much information as possible, but also qualifying that to say that it's very rare that models are perfect. But what the modelling does is give you a guide as to what is likely to occur. The modelling is likely to give you a guide as to when the system will be under the most pressure, when our staff will have to be under the most pressure. So the modelling is a guide which allows government to make decisions based on the health advice, based on what our experts are telling us, and is the background really of our way out of this thing. It's our background.
You can see though using that national rate of 5.5% was misleading to the public because it's in fact 11%.
Not at
and the
all.
week before it was 12%.
Not at all. We have been so transparent every day. We give you excuse me, hold on, can I answer this question? Every day we stand here and tell you the number of people in ICU, the number of people in hospital, the number of people with COVID. We are so transparent with our information, and this modelling, I doubt any state's been able to provide this level of detail in their own modelling, and we will be at the forefront of that.
You said the hospitalisation rate 5.5%.
Now it's 11%. Was the 5.5% figure that you said incorrect?
Look, this is all about making sure that the best information we provide the public on a weekly basis is the most up-to-date information. And that is what's important. So every week our experts put out...
You didn't give the correct and most up-to-date information. So you're asking citizens to come on this journey and trust you, but that rate was wrong.
Oh, look, what you see in the modelling today, I doubt that every single number will be correct to the nth degree. But what the modelling does is give you good direction and good vision of what is likely to occur. And I think the public would much prefer that we put out the modelling that I have access to, that I see, the most up-to-date modelling, so that people understand and appreciate why we make decisions the way we do, and also what is likely to occur in the next few months. And that is what is... But will the figures change week to week? Absolutely, because what we're basing the modelling on is what we assume is the case, but the actual facts are the case numbers we report every day.
And we don't normally deviate on the topic, and it might be premature. My information is that the child has been found alive up at Putty at the moment. If that's the case, your reaction to it?
Oh, look, I'm sorry, I don't know if that's the case, but if it is, I'd be absolutely delighted. I mean, I think all of us have been crossing everything to make sure AJ's brought back safely, and if that's the case, it's a much-needed good news in otherwise difficult circumstances.
Premier.
You say that this plan you've been working on this since the beginning of the pandemic. We saw, at one stage at Westmead Hospital, 11 ambulances waiting to unload for more than 6 hours for COVID patients. Why wasn't this plan enacted earlier, and can you try and help us understand why that happened if this has been worked on for so long?
Yeah, so look, I think as you get an opportunity to read through the plans, it's really complex in regards to the intersect of all what might move you from a phase 0 to a 1 to a 2 and a 3. Okay, and I think that's and what we're watching. So I guess there's some immediate plans on operationally on that particular day. All right, and sometimes, as Susan Pearce has talked about, is that pre-existingly the ambulance has a particular way of moving patients, and you've heard about ED block and all these. So those inefficiencies that have occurred, or those challenges that have occurred previously, have we timed that diversion at the right time? I think that we're learning about, because it's really difficult. Because if you imagine that we may have a plan of a morning, for instance, or we've got this plan that's been drawn up, but all of a sudden there's 8 patients from the Westmead area who have called and they need urgent care.
Can I ask a follow-up question?
Sure.
When you've got ambulances transporting COVID patients, 3 times the amount that is expected, ambulances transporting them long distances all over the city, how does that impact on our emergency response over the next 3 months?
Yeah. So we've been, although this is sort of not intensive care, we've certainly been speaking to our ambulance colleagues, right? And I think an example or reflection of how well coordinated we are is the principle that if we have a really well have a lot of visibility over the system, and they can see that the ambulances are starting to get dispatched to a particular area, hospital, and anticipate that the wait time there is going to be, 2 hours, that in fact the net time may be an hour across the city will still save them time. And I think, I talk to the fact that will we get this right every day and every time? No, we won't. Okay, the system's too complex. There's too many variables, from patients to staff to car availability, and all. They're so complicated. But can I reassure you that the foundations and the principles of the approach is there, because every member of health is committed to providing the best care they can for the patient with visibility of what's happening across the system.
Do you have a breakdown of how many of the 1,550 surge capacity beds are beds in major regional hospitals, and what the contingency plan is for transfers to the city?
So that's a good point, in that, we talk about a whole state capacity, but the work behind that has been at the hospital level and how many beds they can ramp up. Okay, I think that, as you would imagine, we know that the ability for Broken Hill to ramp up, quadruple their capacity, is not possible. All right, so we know that. We appreciate it. We talk to our clinicians. So there is a breakdown, but it's a combination of, they may have a lot of operating theatres that they can move into and make into an intensive care, but as we say, it's limited by staff. Right? So in regards to contingency plans, we have aeromedical services, extra helicopters and planes out, and teams out over in Western New South Wales. And I think that the community will be aware of this, that transfers from outer regional areas occur in normal times for services that aren't available there. Okay, so this occurs normal times, so we're building on that in the anticipation that with COVID and Western New South Wales, and we're watching that really carefully at the point in time, and we're in regular contact with our colleagues out there. How are you going? Checking in. Do you want us to do it preemptively? We might be talking to them every day to say, look, it's looking okay today, but we're looking, in a couple of days' time, we might get into trouble with either staffing or otherwise. So the system's ready to either move staff or to bring patients, if we need to the city.
Modelling, you've built in non-COVID patients as well. Can you just sort of talk us through that, how that's going to affect, people with COVID and non-COVID?
Yeah. Look, I'm aware that the model's based on that particular day, there was about 400 patients without COVID. So these are patients who have had emergency surgery. They might have come in with a bad infection that's unrelated to COVID. What we know is that there are a proportion of those patients that, when we need to, they could be looked after by other teams in places outside of the intensive care. So a post-operative monitoring after emergency surgery, for example, was a really good example of a patient where they'll spend a night in intensive care. In the morning, we try and get them to the ward. In an alternative model, these patients may be looked after by nursing staff or anaesthetists in an operating theatre area or recovery. Okay, we're not going to be able to stop the patients, and actually what we don't want is patients who have heart attacks or have strokes not come to hospital for care. Right? We'll be able to manage that. Have we needed to explore not only different physical areas but different ways to support the staff to manage the patients? We absolutely have, because we've watched it occur overseas. You would have heard about different models of nursing and team-based care. These are sort of terms of models that have been written up over in the UK and in other areas. And we've learnt a lot from that. Will we it'll be absolutely reluctance that we move to that. And I think that if we go back to that fundamental principle that we talk about, is that we will maintain the same level of care that we have at the moment for as long as possible if we're a united system. Okay, so we're not going to have a totally different change in model of care at one place. It might occur for a few hours while we're trying to rally staff or move the patient. But we're not going to have that occur when there are other places across the city that aren't under strain.
So, just in terms of the staff capacity, though, we've talked about
upskilling nursing staff. Is there any call out to other states to bring clinical staff here?
So look, it's sort of our job is to identify what the deficit or the gaps are. Okay, so we are, with the modelling in hand, a clear idea about workforce plans from both a state, like so a local level and a state level. I imagine that we will be going through processes where we call out within our state, and then it may come to that. But yeah.
Have you spoken to the health departments in other states? At this stage, no. Every single local health district in New South Wales, as Nee has said, over the course of 2020 looked at their staffing model. For example, we have upskilled over 2,000 registered nurses who had previously worked in ICU in our hospitals here in New South Wales and done some refresher training with them. Physios, there were over 400 physios who we gave some critical care training to last year. So our first and best endeavour, obviously, would to be use our staff from within our own system, and that's why it's important that if you're moving into an area outside of an ICU, for example, to care for people in a different way, that we've got staff that are skilled and capable of doing that.
And when you say outside of an ICU, sorry, just in terms of I know we spoke about theatres and recovery wards, are we also looking at field hospitals, or are we just looking at the hospitals that we've got and using the spaces we've got in there?
Look, field hospitals were put in as part of a planning exercise. At this stage, we are not anticipating field hospitals. You've got to plan for worst case scenario, and so obviously a lot of work was done to plan for that eventuality if we ever got there. But at this stage, based on the numbers that we're looking at through this modelling, we've got spaces and there are built capacity within hospitals. North Shore was a good example of that, where they were able to open areas within the built capacity of the hospital that existed. And most of our hospitals have obviously looked at those types of models. So recovery is one area. Nee's mentioned coronary care units and those types of spaces. So at that stage, that's where our planning's at.
Does the modelling take into account a rough estimate of how many healthcare workers will need to go into isolation because they've been exposed?
No, the modelling takes into account a range of factors, including social distancing, mask wearing, the number of cases in the community, the number of cases in hospital, and the rate of vaccination, importantly. So that's critical. We have planned, though, obviously, the obvious thing that you would do in this situation is contemplate that staff would be furloughed as a consequence of close contact with COVID. But of course, with more and more staff now being fully vaccinated, that helps us as well, and obviously the PPE. So those assessments are made on that basis, but that planning has occurred.
How does that... Oh, sorry.
So fully vaccinated healthcare staff who may be exposed, will they be allowed to keep working through this difficult time?
Each case would be dealt with on its own sets of facts and circumstances in terms of the exposure. I'm not saying that, no.
Susan, does this factor in burnout as well? Because this is a big couple of months ahead for our healthcare workers that they're looking at now and seeing what's to come. They're already saying they're at their wits' end. What are we doing to sort of plan ahead for that sort of circumstance?
I think Dr. Nguyen has touched on that issue already in terms of offering support, and that's our job, is to make sure that our staff are properly cared for during this period. We all play a role in that, and our district chief executives and all of their teams are very focused on ensuring that fatigue relief is provided to people, but this is going to be a very challenging period. Some of the other work we've done, for example, in the vaccination space, because you'll understand with the military size exercise that's going on at the moment around vaccination, we're training up other people to be able to vaccinate so that we can pull registered nurses back, for example, from vaccinating. They're all of the types of things that are underway at the moment, because we do acknowledge that staff will absolutely need to be cared for during this period.
Dr. Chung, may I ask you about aged care? It seemed at the start of this Delta outbreak that if there was an outbreak inside an aged care home, that all of the positive yet asymptomatic residents would be taken to hospital. My understanding is now they're not being taken to hospital under those circumstances. Has a specific decision been made to keep them inside the residential aged facility, and what are the risks that are associated with that?
I think one of the important factors is our aged care sector has been much better prepared this time round, and it's so pleasing when we hear the high vaccination coverage in our aged care facilities. And what we're working with the Commonwealth to do is support the aged care staff to get vaccinated. So there will be a case-by-case assessment. As always, of course, we look at what's in the best interest of the facility. Not all facilities are created in the same. They have constraints on whether they've got single rooms and other staffing. But at this moment, we are working very closely with the aged care sector and the Commonwealth, and we have incident management teams that have contribution from the aged care sector, the Commonwealth, and public health and infection control, as well as clinical services, to look at what the best way of managing the patients are and the particular circumstances in each case. Can I just make another point? We have seen the scary trajectory and been reassured about the hard work that our intensive care and our staff are doing to prepare for this. But we can change that trajectory. That trajectory is modelled on a couple of assumptions, one of them being vaccination coverage. Okay? We have that in our palm of our hands. The Commonwealth has announced that it's procured additional doses, and we're grateful for their efforts to bring forward some of those doses. There will be greater access. And so my plea is to the pharmacists and the GPs that have been working so hard. Please do not leave any vaccine in your fridge as the supply situation improves. Make sure you get it in every person that you can. So redouble your efforts. I want to see us reach 80% first dose this week. Okay? I want those second doses in arms. And I'm just a bit of a call for arms. You know, vaccines take 2 weeks to work, and 2 are better than 1. So can we just have this as the week that we get vaccinated? And that will then mean that the lot of our intensive care colleagues, our ED colleagues, our ambulance and paramedic staff will be a little bit better.
Local case issues. So cases are really rising in Canterbury Bankstown, right? It's got most out of any place in Sydney. Is there any particular reason why that is the case in Canterbury Bankstown, and can anything extra be done specifically in that area to mitigate it? Maybe, I don't know, send in more contact tracers or something?
So we have clearly got hotspots, and every day I read out those suburbs, and they reflect the activity. And if you go to the government websites, you can see where the case numbers are high. It is important that we're not complacent elsewhere, because we are seeing some creep into other areas, and therefore it's just as important that you're vaccinated, regardless of where you are in the state. I would like to say that the local community, the local government, the local health districts have been working in partnership with a vast range of organisations to increase access to testing, to create increase access to vaccination. And again, it's been pleasing to see those vaccine uptake numbers. But when it comes to vaccination uptake, I'm really greedy. So what I would say is we'll continue to work with those communities that are experiencing the challenges of high case numbers. And we need to work in multiple ways, because those communities, those resilient communities of southwest and western Sydney are very diverse. And so we need to work in different ways with different community groups. And we need to get those vaccine levels up, and we need to get those testing early and those isolation of cases and contacts as early as possible to break those chains of transmission.
And do you think it was misleading for maybe for the public to be hearing a hospitalisation rate like 5.5 over the past week or so, getting these numbers, which are quite different than the 11% we're at now? I mean, just to give people an understanding of how they should understand or comprehend the sort of numbers that they're hearing.
I think the numbers are going to change, and that's because if we have a very highly vaccinated population, you will see a lower rate of hospitalisation. So I think that the community on this journey is going to have to test the data, and we put out data in various ways, but always ask those questions. So what we would be expecting to see is that as vaccination increases, that our hospitalisation rate decreases. It also depends on the age group. because clearly if you've got outbreaks that are touching the very elderly, potentially in those multi-generational homes, you will actually see a higher hospitalisation rates. That your chances of being hospitalised if you're elderly are much increased. So again, if we can keep cases out of settings where there's elderly people, that will improve. So I think that one particular number, that number will change, but I think it's important that the community asks those other numbers about what proportion is vaccinated, what's the uptake in the community, what's the age profile, a number of measures. And we have a variety of reports that are on the website, and I think this will be a journey as we learn to grapple with different and changing numbers as we go through this response phase.
Dr. Chair, are you advising that it's safe for any regional areas to come out of lockdown in 4 days' time?
We're currently just reviewing all the data from the weekend, and we'll provide our advice to government. I would just again urge our regional communities to get vaccinated. Vaccine supply should be increasing through general practice in a number of those settings, and again I just encourage people not to delay. Please get vaccinated, and I want to particularly call out our rural GPs and our pharmacists for the good job they're doing in getting those vaccine rates. That is so critical for the upcoming 2 weeks. That's what you can do to relieve some of the pressure on Dr. Nguyen and the ICU. So please do it. Please, after this, go find a booking. Thanks.